With the alarming rise of dengue in our community, it's important to understand this disease, its origin, effective preventive measures, and explore the potential of homeopathic treatments to manage and cure dengue fever. Dengue cases are soaring in India, reaching critical levels, requiring urgent attention and action. Through this video, we are trying to make people aware of dengue, its transmission, management, different tests, and treatment. It is important to know how dengue is transmitted to stop its spread. The dengue virus is transmitted to humans by the bite of an infected Aedes aegypti mosquito. When the mosquito bites a person who has dengue virus in his or her blood, the mosquito becomes infected with the dengue virus. An infected mosquito can later transmit that virus to healthy people by biting them. Dengue cannot be spread directly from one person to another, and mosquitoes are necessary for transmission of the dengue virus. So we can stop dengue from spreading only by not allowing a mosquito bite. The symptoms of dengue begins abruptly after an incubation period of 5 to 7 days. You can look out for these symptoms to diagnose a dengue fever, like there will be a high rise of temperature along with severe headache. There will be pain in the eyes along with nausea and vomiting. There is a severe muscle and joint pains along with fatigue. The person feels to lie down all the time with profound weakness. And sometimes it is also accompanied by rashes all over the skin. But it is very important to take note of the warning signs of dengue, which we also call the Dengue Shock Syndrome, where there is a need to urgently hospitalize the patient. The patient complains of a severe abdomen pain. There is a frequent vomiting, bleeding from gums and nose, and there is blood in vomit and stool. So if you find any of these symptoms, please rush to the hospital immediately and look out for more advanced treatments. Before treatment, we should look out for prevention. Adapt these basic guidelines to stop dengue spread. Destroy all mosquito breeding sites by using pesticides, and do not allow water to stay stagnant in one place. Sleep under mosquito nets and use mosquito repellents. Always wear protective clothing. Kids should always wear full sleeve clothes when they play near a garden. Drink plenty of fluids and take adequate rest. Consult a doctor immediately if you find any dengue fever symptoms. To detect the presence of the dengue virus in the blood, several tests are necessary. NS1 antigen test is most commonly done test within the first 5 days of symptoms. This test identifies an active dengue infection if the result is positive. Dengue IgM test is a test of an antibody early in the disease, helping distinguish between primary and secondary infections. The next is dengue IgG test. This test is done after a week. A positive result indicates a previous dengue infection. The last is dengue RNA PCR test, which is a confirmatory test for the infection and also identifies different dengue virus serotypes. Additional tests are also necessary to assess the disease severity, including complete blood count and liver function tests, with daily monitoring of WBC and platelet counts to evaluate the patient's health. The treatment for dengue is given symptomatically. Ideally, the patient should be hospitalized to keep a check on platelet counts, and as there is a lot of loss of fluids from the body, patient has to be administered IV fluid to keep him hydrated. Patients of dengue can easily go into hypotension, so continuous blood pressure monitoring is also very important. There are some of the homeopathic drugs, when administered along with other conventional drugs, can speed up the time of recovery in the patients. Homeopathic medicines like Eupatorium perforatum is one of the drugs best known to reduce body pain considerably in the patients suffering from dengue. Apart from this, drugs like aconite, gelsemium, Bryanea alba, Rustox, and Ipecac, etc. can be given as per the symptoms. Overall emphasis should be given to maintain hydration in the patient suffering from dengue. That will drastically reduce the chances for hospitalization. Encourage the patients to take ORS, fruit juice, coconut water, lime juice to keep him hydrated.